Tens of thousands of chemicals are used in workplaces without proper tests for effects on health and the environment. Around 248,000 substances exist in the market, but there's only information available for around 6,000 of those. That means less than 0.15% of chemicals used in our workplaces have been properly tested for environmental and health effects. It's no wonder that a person dies from exposure to toxic substances at work every minute. Every minute.
Several studies have documented that over 80% of all workers that die as a result of their work die of occupational disease rather than the sudden violent accidents that we typically hear so much about. If you're talking about occupational disease, it's obvious that most of those are caused by exposure to hazardous substances, such as dangerous chemicals in the workplace.
If we are going to stop the bleeding, we must act now. At the Johannesburg Summit in 2002, governments endorsed a goal which is vital for workers everywhere. By 2020, all chemicals must be produced and used in ways that minimize significant negative effects on human health and the environment. Unions want governments to honor this commitment. They have concrete ideas to help achieve it, and they want to be part of the change. Where can we start? We must eliminate the most dangerous substances. Banning asbestos. Asbestos is the biggest industrial killer and causes more than 100,000 deaths per year. In the case of asbestos, its association with lung cancer had already been described in the 30s, but it took over 50 years to start banning it in some countries.
The best way to remove the hazard of asbestos is, first of all, to ban any further use of asbestos globally. At the moment, there's extremely heavy use in Asia, still being mined and exported from Russia, Kazakhstan and Brazil, and arriving principally in Asia.
Eliminating highly hazardous pesticides. Around 3% of agricultural workers suffer from acute intoxication from pesticides. There is no data available for chronic intoxications.
We've been working for some time on a specific list of pesticides. It used to be called the Dirty Dozen, so the most toxic, some of the most damaging. Those included things like endosulfan and paraquat. Paraquat is widely used as a herbicide in many crops. It's banned here in Europe, but still widely used in developing countries. So this is our absolute priority at the moment. It is the most toxic of pesticides. Minimal exposure is fatal.
Eliminating the most hazardous substances is the only solution. When in countries like Bangladesh or the Philippines, less than 10% of pesticide users wear basic protective clothing. Workplace carcinogenics. At least 1 in 10 cancers are the result of preventable workplace exposure. Europe's trade unions are helped by their own safety think tank, the European Trade Union Institute, which focuses on carcinogenics.
In the EU, each year we have 100,000 workers that die because they are exposed to carcinogens at the workplace. So that's the first cause of death at work. All those occupational cancers and deaths are preventable. And the idea is to try to avoid having workers exposed to carcinogens. So the best way to do that is substitution.
We can make it happen. Many unions are fighting to eliminate toxic substances at work, to get strict protection from related risks, and to get justice for those harmed by toxic exposures. They will continue to do this as we move towards 2020.
So for the ITUC, these next 4 or 5 years will be critical in trying to outreach to all our union members so that they know that chemicals is a top priority for their health, for their lives, that a lot of public resources are actually going to be expended if we do not address this issue with prevention policies. Our priorities are also going to go into awareness raising.
Unions from different countries are working to protect workers. Globally, the IUF has trained farm workers on pesticides risks in many African countries. Results are remarkable. Those workers trained then managed to substitute most of the hazardous substances. They are much more aware of protective measures and are improving the statistics they record. Industrial and BWI are working on a campaign on zero occupational cancer. In Spain, the CCOO is following up this campaign nationally.
Actualmente, mi organización, que es Comisiones Obreras de España, ISTAS, estamos llevando a cabo una campaña que se llama Cáncer Cero en el Trabajo, en la cual tratamos de mejorar las condiciones de trabajo de todas las personas que están expuestas a sustancias cancerígenas y sustancias muy peligrosas en el lugar de trabajo.
The CCOO regularly trains worker representatives on chemical risk management. The union has a network of more than 120 advisors for union reps that have answered many thousands of queries related to chemical management. The steel workers in the US and Canada launched a campaign to put breast cancer out of work. In Uruguay, PIT-CNT is planning to train 50% of chemical workers and will obtain concrete results.
En el sector de la industria química, lo vital ha sido el trabajo que hemos hecho a partir de los sindicatos en cuanto a exigir en algunos casos el cambio de las tecnologías y en otros a establecer fundamentalmente medidas de organización de la producción que minimicen el contacto de los trabajadores.
Sustained labor projects in countries such as Brazil, Dominican Republic, El Salvador, Malaysia, Uganda or Togo have shown that change at the workplace is possible by building the capacity of workers.
We have been training, raising awareness and providing practical tools to union reps and to workers too in many different countries. Things such as where to find information on substances, risks, safer alternatives, prevention measures. And we have been also working with national centers, with unions at national level in improving national legislation, its implementation and its compliance.
Moving towards 2020 is also about workers' rights. Firstly, participation and consultation. Workers demand the right to participate in health and safety programs, and this includes chemical management. Joint health and safety committees have shown to be an effective way to improve conditions. Secondly, the right to know. Workers must have the right to know the dangers of what they are using and their effects on health and the environment. Third and last but not least, the right to refuse. Workers must be able to refuse or stop dangerous work, and there must be legal whistleblower protection.